A study a few years ago in Hamilton found that if you live in a certain well-to-do neighborhood, you can expect to live, on average, to age 83. On the other side of town, residents can expect to live to 62. How could residents of the same city have such radically different chances? Well, it comes down to the basics. How much education did you have? Do you have enough nutritious food to eat? What kind of early childhood did you have? Do you have an adequate roof over your head? And above all, are you rich or are you poor? It is these social determinants of health, more than anything else, that determine how healthy Canadians are. Beyond the issues of how we, as a society, view this unfairness and inequity, they determine in large part the demands that are placed on our healthcare system. According to the Public Health Agency of Canada, 1 in every $5 spent on healthcare in Canada is attributable to the socioeconomic factors such as income. Statistically, the healthcare system accounts for only 25% of the health outcomes of Canadians. Biology and genetics account for another 25%. But fully 1/2 of how healthy you are depends on your life circumstances. So what this means to me is that in some ways we've been actually looking at healthcare the wrong way around, putting our entire focus on trying to fix the healthcare system rather than also looking at the upstream factors that lead to poor health in the first place. We also believe it is time for the federal, provincial, and territorial health ministers to come together to discuss meaningful transformation of the healthcare system, something that has not occurred in a long time. The federal government must be a catalyst in developing a pan-Canadian vision and plan for creating an accountable, patient-centered, efficient, and effective system that can meet Canadians' needs. We need a pharmaceutical strategy for the millions of Canadians who aren't taking their medications because they cannot afford them. We need a seniors and a dementia strategy to help our country cope with an aging population and the pressures that this will place on families and communities. And we badly need more long-term care infrastructure. We also need to take a closer look at the overriding factor in determining a person's health status: poverty. Spending on health without addressing the underlying causes of poor health makes no sense. At a time of immense social and economic pressure, Canadians look to their leaders to act in their best interests. It isn't good enough to slough off responsibility to other levels of government or to stakeholders, or to suggest that Canadians are more concerned about jurisdiction than they are about the overall health and well-being of our society. It is time to take ownership. By the same token, it is not all up to governments either. Every sector of society has a role to play in bringing about change, and the business community is no exception. In fact, the business community has a vested interest in Canada's healthcare system. Many of you are no doubt aware of the value Medicare brings to our economy. As studies by the global accounting firm KPMG indicate, time and again, Canada's health and social services provide an important international competitive advantage to business. The health sector provides essential services and generates over 1 million jobs, representing about 10% of Canada's labor force. Healthy Canadians come to work, are productive, contribute in their jobs, in their communities, and to their families. A healthy workforce leads to increased productivity in the workplace, and healthy businesses lead to a healthy economy and a strong country. At the outset, I said I would make the connection between health, economy, and business, and I hope I've started to do so. So this is not just about hospitals or physicians. This is about our values, our commitment to our fellow citizens, and the kind of society we want to leave for the Canadians of tomorrow. It's time to act. Thank you. Yeah.